I think the very long hours that the nurses are working at the moment, and a lot of the wards seem to be very short-staffed, so they're having to do twice the amount of work that they have to do. The patient is a plus-size patient, and this patient had been on respiratory ward for at least about 10 weeks. One of the areas on talking to the patient was that she felt that when she was being bathed in the bed, it was taking the staff quite a long time. The water became quite cold, and it was also very undignified. We identified this patient as a suitable candidate for our eco shower system. We brought it in the next day and it remained at her bedside, and she was actually able to do her own bathing every morning. Usually it would take her, anything up to 30 minutes to actually wash her. Half an hour may seem a very short period of time, but for a nurse on a busy ward, that's massive. It's a massive impact. They were running back and forward to the sluice room to try and get water. She was not mobile, so usually it would take about 6 to 8 staff members to actually reposition her, which can be really difficult, especially when you're providing personal care to a patient. So the fact that they didn't require those staff, you can imagine the impact that this had on a ward. After speaking to a few of the clinical leads on the ward, it made such a difference that all of a sudden she wanted to be able to do things, and she wanted to be able to get out of bed. When somebody feels better, I think it gives them the motivation to actually do something a bit more. At the end of the day, they can go home knowing we've done the right thing. We've given the patient the best that they could possibly have. Nurses are known for caring about patients, but that's something a lot of the nurses talk about. And no constraints, sometimes they're not able to, but that's where we come in, and we're there to give advice, to discuss the appropriate equipment that can actually move that patient on.